Welcome to Expedite Aviation English. This lesson will help you to improve your fluency in discussing health-related situations.
In an ambulance.
We need an ambulance to meet us at the gate.
Is the passenger conscious?
He's in and out of consciousness.
What happened to him?
We're not sure.
We think he overdosed on sleeping pills.
He was afraid to fly.
Did he drink any alcohol on the flight?
No, no one served him alcohol.
He has asthma.
There is a child having an asthma attack on board.
Does he have an inhaler?
Yes, but the symptoms aren't improving enough.
Do you have a doctor on board?
Just a nurse. She's giving him oxygen right now.
She has diabetes.
We have a 48-year-old female passenger who is having a diabetic episode. Her blood sugar is too low.
What is her blood sugar?
It is 35. She's unconscious. Request priority landing.
Has someone tried to give her an injection of glucagon?
Affirmative. A nurse on board is doing that as we speak.
Why are you sneezing?
We have fumes in the cabin and many passengers are sneezing.
How many people are having these symptoms?
About 10. They are all in front of the airplane.
Are the flight attendants having trouble too?
No, just passengers. She's pregnant.
Is she in labor?
Yes, she's having contractions.
How far apart are they?
About 5 minutes apart.
Did she break her water?
Not yet.
How far along is she?
She's in her 7th month.
Emergency landing for a heart attack.
We have an elderly man on board having a heart attack.
Do you have a doctor on board?
Yes, we do. He did an EKG and determined that it's a heart attack.
How old is he?
62.
Does he take any medication for a heart attack?
Yes, he took nitroglycerin and he takes blood pressure medication. There is a doctor on board our aircraft. He thinks our passenger is having a stroke.
What are his symptoms?
He's dizzy, having trouble seeing clearly, and he feels numb in his face. Requests emergency landing.
Is he taking any medication?
He just took blood pressure medication.
Is he having any symptoms?
No, he isn't. Can we get a wheelchair to meet us at the gate?
What happened to the passenger?
She fell when she was walking near laboratory and we encountered turbulence.
She is in a lot of pain?
How old is she?
She's 63. One of the passengers was standing up when we flew through turbulence. He hit his head and hurt his arm.
You should find a bandage for him and give him some medicine for the pain. What else can you do?
One of the passengers became nervous and started having an asthma attack.
Other than an inhaler, how else can you treat asthma?
One of our passengers has a broken foot. The wheelchair hasn't arrived yet. Can you send it soon?
You need a wheelchair when the passenger is conscious, but cannot walk for some reason. What are some examples of situations that require a wheelchair?
She's dizzy and sweating. I think her blood sugar is too low. We're getting testing now.
She is diabetic. What are some ways you can treat a diabetic with low blood sugar? Interact with your teacher in our live virtual Aviation English classroom to improve your Aviation English proficiency. We offer classes for level 2, 3, and above. Or, if you're ready to take your ICAO English exam, you can prepare yourself with our strategies for ICAO